When trying to find a therapist, you probably see all kinds of acronyms at the end of people's names and wonder what they mean. So stick with us today, and we are going to talk about the differences between an LCSW and a clinical mental health clinician and all the different kinds of acronyms that you might see when you're looking for a therapist. Any stories shared in this podcast have had names and details changed for the confidentiality of clients. Any resemblance to someone real is coincidental. Hello everybody, thank you for joining us for today's video. Today we are going to talk a little bit about the different types of therapists, not in the sense of like, are you a trauma therapist or an anxiety therapist, but in the different educations and types of licenses and the different acronyms you see after somebody's name, if they are some kind of clinician. So just off the top of my head, the ones I always think of are LCSW, LMFT, CMHC, or psychologist. Did I miss a big one? Psychiatrist, okay.
Yeah.
So, I don't know. The short answer is they're all different degrees that people got that led them to a different kind of specialty, but what's the long answer? What's different about all these?
I'm glad we're talking about this today because I can't tell you how often I hear people ask me for a referral and they'll say, hey, can you give me a referral to a psychiatrist? Or, hey, I need to come see a social worker. And they aren't very clear about what they're asking for. Like, to me, that really means something, right?
Sure.
I'm like sending them someplace specific. But for them, they might not even know what it is that they're asking for. So I'm glad that we're going to talk about this, and I do think that it's important to know some of the really big differences between all of these different things, because it's not just the amount of schooling, it's also what that person is likely going to do to help you with your issue.
Yeah.
I'll start it off by just the basic of what did we mention, 5?
Yeah.
The psychiatrist is the only one that does medication.
Yeah, that's important.
Right, so that's important. So if you're feeling as though you need somebody who does therapy, it's not psychiatrist, because psychiatrist is going to look at it from a medical model, and they're going to look at, okay, what symptoms do we have and what kind of medications can we use to treat these symptoms. The other 4 are going to probably use more of like a behavioral or a cognitive approach to reduce symptoms, but psychiatrist is medication.
Right, and there are some psychiatrists who do therapy too, but not very many.
Yeah.
Right, for the most part, somebody who has gone to school to become a doctor, because a psychiatrist has gone to school long enough to become a doctor and specialize in psychiatry, they usually are doing the medication prescribing.
Yeah, I have lots of clients who come see me as a therapist and also see a psychiatrist to manage their medication.
We should also throw out there that in the medical world, there's other mental health medication specialists, but we probably won't talk about it because we're not doctors and we're not nurse practitioners and psychiatrists. That's a whole different ballgame, but maybe we invite Melanie back and have her do that.
Sure.
Yeah,
right?
maybe.
But as we talk about these different types of therapists, maybe the 3 of us are social workers, so maybe we talk a little bit about our background and talk about the difference between, I don't know, social workers and psychologists, or social workers and MFTs. So social work. What do we do? What's our understanding? What's the education background? What do you think people hear when we say social worker? Because my brain,
things.
I was going to say, my brain goes very different than what I actually do.
Yeah,
Right.
so that's what an LCSW is a licensed clinical social worker. That's like the highest license a social worker can obtain. So all 3 of us have our LCSW. We are all got a master's in social work degree, and I've had experiences where I remember once I had this teenager and they sat down in my office and they're like, well, I need to talk to a therapist because I hate social workers. It's like, I'm so sick of social workers and they just ruin my life and blah, 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 all these things. And I have like these social work textbooks behind me on my shelf, and I'm like, I have bad news for you.
Did you say that?
Yeah.
Yes.
Yeah. I was like, many therapists are social workers. I don't know if this is true, but I dare say a majority of therapists are LCSWs.
Yeah, and I would say that there are multiple reasons for that. Here in Utah, I think that a lot of people do choose that route because a licensed clinical social worker can do so much as far as supervision, and some of the job opportunities are better. just kind of generally speaking. And I would also say, like, not all social workers are clinical social workers. There's lots of other jobs you can have in the social work field that have nothing to do with clinical work. And so to become a licensed clinical social worker, there are additional things that you have to do to get that kind of a license.
Yeah.
So it isn't just that you go through your degree in social work and then you have this license. You have to do a lot of clinical work to be able to have that as your letters after your name, right?
If you don't do the clinical route, you end up as a CSW, a certified social worker, and that's not clinical work necessarily.
Right.
But I do think there is something to it. It's probably the most broad of, as we talk about LMFT and these other things. I think you're right. I think that's why it attracts the most people, is because it gives you the most options, and so it attracts people who have different interests in the general field of social work.
Okay, social worker versus psychologist. So there's the social worker. Now walk the psychologist route.
It's funny that you bring this one up, because I have had probably, 4 or 5 conversations with people I worked with at a previous job, just because a lot of them were coming right out of high school and getting this job at this treatment center because they took people out of high school. And they would say, I'm going to go to school for psychology so I can be a therapist. And I'd be like, oh, well, don't do that. Go get social work. And I convinced all these people to go from psychology to social work.
Did you?
Or mental health counseling, or a licensed marriage and family therapist. You don't have to have a psychology background to do any of those.
Yeah, but I think that I thought the same thing when I started school. I was like, oh, if I want to do that, I have to go get a psychology degree. And I had an advisor tell me otherwise. So I think it's a really common belief, is like, psychologist is a therapist. A psychologist can perform therapy, but typically at a doctorate level. But for the most part, I associate psychologists with doing more evaluation and research type things.
Lots of testing.
Yeah.
I would say the majority, and I don't know a ton of psychologists, but the ones that I do know do more along the lines of psychological testing, either in a school setting or a medical setting. And, like a psychological testing will really tease out different things like your diagnosis and that sort of thing on a much deeper level than you do in a mental health evaluation with a therapist.
Yeah. They'll evaluate all these things and then send you to a mental health professional that is fitting.
Does the therapy.
Yeah.
And again, a psychologist doesn't, I think that there actually is like extra schooling a psychologist can do to become a medication prescriber, but I think generally psychologists don't do any medication prescribing, and it is more along the lines of research or diagnostic stuff.
Yeah.
It's fair to say that we probably know at least one psychologist we talked about, perhaps a couple more that do therapy, probably to the same extent that we do as clinical social workers. At what point would you, as a clinical social worker, make a referral to a psychologist? Have you ever considered that?
I have, and I have referred people to a psychologist before if they are pretty unsure about their mental health diagnosis, or if they have a pretty complicated presentation and they would benefit from having more information about what their diagnosis is, kind of getting their diagnosis confirmed, or even along the lines of having specific testing for something like autism. In those kinds of situations, I have referred to a psychologist because as a licensed clinical social worker, without extra specialized training, I can't give a diagnosis like autism.
Yeah, my experience with psychologists have been exactly that, and their psychological assessment or their psychological evaluation is a much more in-depth with the use of standardized testing materials, right? I've had a couple recently, not like a couple, but like a couple of clients that I work with that have gone to do these assessments, and I think both of them have mentioned, yeah, I got to question 287, was like, I'm done. And so then they're just like, but in a mental health assessment, if I'm going to give a diagnosis, I'm not giving you 400 and who knows how many standardized questions or questionnaires to do to come to a diagnosis, but a psychologist would.
Right. And, when you see in the movies, like, you got that person who pulls out the pictures of the ink blots and, like, what do you see here?
Yeah.
Right. And I think as psychologists, I do sometimes think a little bit more of that because psychologists lots of times do measures like that on your psychological assessment. And it's way more in depth. Like, I'm probably never pulling out an ink blot for you to look at in session. I would have no idea what to do with that.
Yeah, can you imagine a 4-hour test? Ugh. Which I think half the time they're not even sitting with. They're like, hey, here's these questions, fill these out.
Right. Well, and lots of times, like, 4-hour test, and then you get this report back that's 30 pages of here is your full psychological profile.
Which it's also probably worth saying, if they do that in depth of an assessment and they give you diagnoses based on those standardized questionnaires, they also do a fairly rigorous is maybe the right word, maybe that's too much, but treatment recommendations section 2. And oftentimes the treatment recommendation is go to therapy, whether it's a clinical social worker, mental health counselor, or marriage and family therapist, and they would benefit from this type of therapy and this, that, and the third, right? So anyway, that's been my experience with psychologists too. Any thoughts on clinical mental health counseling versus marriage and family therapy to throw in there?
Also therapists, but I think maybe fall under some of the, like we talk about social work being very broad, those are less so. Like, if you're licensed as a marriage and family therapist, you probably also won't be like a case manager at a hospital.
Right.
Which an LCSW could do something like that. But if you're looking for marriage or family counseling, they probably will have really good stuff for you.
Mm-hmm. Yeah, my understanding is they probably get training throughout graduate school that focuses more on a systems-based family dynamic kind of thing, whereas social workers, I don't think, they can do systems-based things, but...
Well, and ours is a little broader, like systems and environment, right? If we're going to look at what that is for social work.
Yeah. So feel free to correct me if I'm wrong, or if there's any specialist out there that wants to make a comment in the sections. I would say that generally speaking, MFTs, CMHCs, and LCSWs do, quote, the same thing. I think our training route to get there is a little bit different, but we all do similar things. You can do couples and families as a social worker. It doesn't mean you can't, you can. The one that stands out differently mildly is the psychologist. You probably have to have the PhD, and you are likely to do assessment and evaluation. And the one that stands out drastically is psychiatrist. I guess I would put that in like a very basic nutshell.
I like that.
Sounds
You're
good.
welcome to disagree if you'd like.
No, it's perfect. Well, thank you everybody for joining us for this video. Hopefully you found it helpful. If you have any questions, we'd love to hear them, and we'll see you next time.
Thanks.
Bye.
If you enjoyed today's video, please like and subscribe. Thank you so much for watching. We've got other videos for you to check out and more exciting things coming soon, so thank you.